Welcome to the weekly Multicultural Media Online Conference. And I'm Jesusa, Helaratne, Deputy Director of the Multicultural Health Communication Service. And on behalf of the Ministry of Health, Multicultural Health Communication Service, and of course, Multicultural New South Wales, we're so pleased that you've joined us again today. Of course, we will have the Minister for Multiculturalism, the Honourable Minister Mark Coure, joining us to ask for you to ask your questions and to answer them for you. And of course, our New South Wales Senior Medical Advisor, Dr. Fizzell, is also joining us with COVID-19 updates. Before we start, we'd like to acknowledge the traditional owners of the land from which we are all meeting today. For Dr. Jan and myself, we acknowledge the Camaragal people of the Eora Nation. We also pay respects to elders past and present and emerging, and also acknowledge the traditional and multicultural elders and leaders who are represented in this meeting today. We'd also like to encourage if you can put your name on the chat and add your name and also where you're meeting and joining us from today. Please put your questions in the chat because we want a lively discussion. Through this session, my colleagues from the Multicultural Health Communication Service and Multicultural New South Wales will be putting relevant links to help give you information of translated resources that are available for your use. So now it's my pleasure to hand over the microphone and the screen to the Minister for Multiculturalism, the Honourable Minister Mark Coure. How are you, Minister?
I'm really well, thank you. And good afternoon, Jess, and good afternoon, Dr. Jan Fizzell as well. And to everyone who's on today's Zoom, thank you. A big shout out to the wonderful work and contribution that multicultural media do on a daily basis in print, in social media, and through the internet as well. So thank you very much. Very quickly, I'd like to acknowledge, of course, the traditional owners of the land and the contributions that they make, elders past, present and emerging. A couple of things, if I can, of course, in terms of Ukraine. Let's begin with Ukraine, of course. There is obviously a Ukraine hotline that community members right across New South Wales can contact. The number of that for impacted community members can call is that 1800 number, 845-198. This is information that has been shared with the Ukraine community leaders. That is, of course, the START hotline, which is a dedicated phone for the Ukraine community between 10 and 4 p.m. each day, who are experiencing trauma and are able to call that number. So that's really important for those during the Ukraine conflict. In regards to floods, I mentioned last week, while New South Wales SES is continuing to respond to a range of operational activities across these areas, has been greatly reduced, as in, sorry, let me rephrase that. While New South Wales SES is continuing to respond to a range of operational activities across these areas, we are seeing, of course, SES out there in force. And I do want to acknowledge the wonderful work of the SES. Relief and transition to recovery operations have been intensified in recent weeks, and the transition to recovery phase under Resilience New South Wales leadership is being worked through a number of LGAs. For information on the recovery, there are a number of centres and financial support out there in the community. They can go on the Service New South Wales website or call Service New South Wales. And of course, obviously check the current community information and advice. There is relevant community advice on a regular basis through SES, obviously the Bureau of Meteorology as well. And of course, there is a lot of information through Red Cross, who are doing a great job on the ground through their Red Cross appeal as well. There is also, in regards to floods, a lot of grants that are available, small business flood disaster recovery grants. And I know the Premier announced small businesses and not-for-profits affected by the severe weather floods in February and in March of this year can apply for grants up to $50,000, which is great for local businesses. Again, a lot of that information will appear, or has appeared, I should say, appeared on the Service New South Wales website as well. And in regards to obviously our empowering, supporting communities grants, which is a grant through small business through Multicultural New South Wales. I was pleased to announce with all the multicultural media here on this Zoom call today, I'm pleased to inform again that there's $4 million is available for a new round of empowering and supporting the local communities grants. Of course, they close 3 p.m. Wednesday, the 23rd of March. All that information about this particular program is on the Multicultural New South Wales website. So we know community organisations and local services are best placed to understand what their community needs and aspirations are. This program will provide the support required as COVID remains obviously in the community, and we'll hear more about COVID from Dr. Jan shortly. So these grants are for local New South Wales not-for-profit organisations who are running community-led programs aimed at reducing transmission, increasing the booster shot, educating their members and their community about, following the health advice, taking appropriate action if tested positive, and so forth. So these grants are very, very important, and they'll go a long way in terms of encouraging community members that, the need to obviously build resilience, recover, and of course the impacts of COVID-19.
That's great. Thank you so much, Minister Coure. And it's wonderful to hear about the grants, and we'll try to put those links on the chat for you. Thank you very much, Minister Coure. And Dr. Jan, it's nice to see you. How are you?
Well, thank you, Jess. So today, New South Wales Health reported 30,402 positive test results. That included 22,748 positive rats. About 10,000 of those results were taken on Sunday and Monday, and there was a small delay in processing information into our counting system, but all of those people had clinical care available to them at that time. We also had 7,654 positive PCR results from a total of 48,987 PCR tests. And that PCR result was not affected by the data processing issue. So there is an increase in cases in New South Wales. The one thing we can do, of course, to try and help prevent those cases turning into hospitalizations is to get our vaccination. So it's good to say that more than 95% of people have had a first dose of a COVID-19 vaccine, and of people 16 and over, 94.5% have had 2 doses. Of children aged 12 to 15, 83.5% have had a first dose, and 79.1% have received 2 doses. And with COVID circulating in our young people at the moment, it's so important to encourage friends and family who may not have started that journey to get on with that journey, to have their teenage children vaccinated. And of younger children aged 5 to 11, 48.5% have had a first dose of COVID-19 vaccine. And again, something for us to continue to encourage our community to have faith in the safety and efficacy of those vaccines. They really do make a difference to transmission. So please do encourage people to get those vaccines. For people aged 16 and over, 61.3% of people who should have had a booster by now have had it. That means we've still got around 40% of people who could have that extra protection that a booster provides who haven't taken up that opportunity yet. And we'd really strongly encourage people to take that offer of a booster up. Sadly, today, we're reporting the deaths of 5 people, and we send our condolences to their loved ones. We've had 1,996 deaths since the beginning of the pandemic in New South Wales.
Thank you so much, Dr. Jan. And yes, we send our condolences to the families of those involved in that. So we really have a lot of questions that we've prepared today. Also, we'll start with the questions. Minister Coure, here's a question from Media. What can my family community do to stay COVID safe while celebrating Ramadan and Hindu New Year and Easter? So there's a lot of cultural and religious celebrations coming up this April.
Yeah, there certainly is a lot of community events that are coming up this April, and we can also include Seniors Week, Harmony Week as well. So in the next 6-7 weeks, there is and the school holidays, not to forget. So in the next 6 to 7 weeks, there are a lot of activities out there with family and friends and celebrations. So this is all about common sense for both the event organisers and the attendees. for anyone wanting to host an event, whether it be at home or in the public, it is all about making sure the health and well-being of attendees is taken into consideration. So encourage the use of masks, encourage good hygiene, make sure that communication with attendees that if they aren't feeling well, to stay home. It's really important if you are not well to stay home. And I completely appreciate the want and the need to attend, to attend these events and to meet people. But if you aren't feeling well, don't risk it. Don't risk your loved ones. Stay home, get tested, and put your health and the health of your friends and loved ones first. For public events, this is where multicultural media is so important. And I want to stress that you help get the message out to people and remind them of the need to be COVID safe. So I'm also continuing to meet with community leaders to remind them of their responsibilities in keeping their communities safe as well. So in conclusion, for anyone wanting to host an event, whether it be at home or in public, it is about making sure the health and well-being of attendees is taken into consideration.
Thank you so much, Minister Coure. Dr. Jan, a question from Violi Calvert from Radio Tunggampay or Filipino Media is, when are restrictions being put back as the cases are getting worse and the new variant now being added to the problems?
Look, I think the thing that we all need to understand in our community is that the things that we know work are the same things that have been working since the beginning of COVID. We know that staying home if we're sick is really important, and using either those rapid antigen tests or to go to get a PCR test if you have those symptoms, so important. But the other thing is, of course, if you've got those symptoms, not to go out, no matter what those test results are, because no one at the moment needs a cold or anything else such as flu. So please, stay home. Wearing a mask if we're indoors and we can't distance ourselves from other people, and that could be going to the shops, that could be at a social event. So please do keep wearing those masks. Don't get rid of them yet. It may not be a public health order, but if you know that there's an area where we've got increases in COVID cases and there are lots of people, it's a good idea to have that mask on. And of course, those other things that we can do, such as meeting outdoors and being careful of particularly old members of the community, and making sure that as far as possible, we encourage each other to get those boosters, or if somebody hasn't started their vaccination journey, to get that vaccine.
Thank you so much, Dr. Jan. Please ask your questions, add them to the chat, and we'll get Dr. Jan and Minister Coure to answer them. Minister Coure, a question here is saying that if a family is flying into New South Wales after being overseas, what are their testing and self-isolating requirements?
Well, it's a really good question. We get that a lot through our weekly conversations with community leaders and religious leaders and media, of course. For everyone coming into Australia must follow the Australian government guidelines. All international arrivals must go straight home or to their accommodation and take the rapid antigen test within 24 hours. So you must self-isolate until you get a negative result. A rapid antigen test on or after day 6 is strongly recommended. Pack your own kit to ensure that you have ready access to them on arrival in New South Wales. And of course, you must register a positive result through the Service New South Wales website, and you do not need to register a negative result or an invalid rapid antigen test result. But you must not visit a high-risk place for at least 7 days after arrival. And if you are not fully vaccinated and are arriving in New South Wales from overseas location, you will need to go into a 7-day mandatory hotel quarantine. So check if you are fully vaccinated. Visit the Australian government website, as other countries may have different definitions of what is to be fully vaccinated. So if in doubt, there is, of course, the 1800 New South Wales Health Isolation Support Line, or the Service New South Wales line, which is 137788.
Thank you so much, Minister Coure. Dr. Jan, a question here is about COVID-19. If you can get it twice, how is it possible to get for someone who has had COVID to get it another time?
Well, Our immune systems don't always remember everything that we've come in contact with, and our immunity can wane over time. So we do know that the coronavirus, the SARS-CoV-2 virus, has changed since it first spread around the world and is still changing today. And the level of protection as we get exposed to new variants does wane. So yes, you can get COVID twice. At the moment, one of the reasons why, if you've tested positive to COVID, you've isolated for 7 days, you can leave isolation as long as you're well at the end of those 7 days. And then even if you become a close contact again, we don't say you have to isolate, because the chances are within that 8-week period, you should have sufficient immunity to not get COVID twice and not be able to spread COVID twice. So that's why for 8 weeks after you're recovered, we don't say you have to re-isolate. After that time, though, we know that people have got reinfected. We know people who had Delta have been reinfected with Omicron, and overseas, we're starting to see some reports of people who had Omicron quite early, because we've had it since about December. We're now 3 months later. There are people who are getting sick with the other sublineage of Omicron. So I think it's really important that people keep taking COVID seriously. Even if you've had COVID before, do talk to your GP about when to get vaccinated if you're still due a dose, and please do take those symptoms seriously. You can get COVID twice.
Thank you, Dr. Jen. I guess that's about the COVID-19 safe behaviors. And Minister Coure, a question here is, when is it time, or when am I required to wear a mask? We're still seeing a lot of confusion regarding where people are required to wear a mask. For Dr. Jan and myself, although we're here for clarity of our messages, we're not wearing a mask, but right after we wear our mask. When is it appropriate and when is it necessary?
Well, look, that's a really good question. And look, face masks are only required when you are on public transport and at public transport waiting areas, planes, indoors, at airports, public hospitals, private health facilities, residential aged care facilities as well, hostels, indoor music festivals where there's more than 1,000 people. But as I say before, and I say all the time, everyone is free to continue wearing a mask if they wish. If you feel that you need to wear a mask, it is extremely important that you do so. And in fact, if you find yourself in a situation where you can't socially distance or keep safe space from others, then I encourage you, as Dr. Jan Fizzell would as well, wear a mask if possible.
Thank you, Minister Coure. Dr. Jan, what are oral antivirals, and who should take them? I mean, this is a question that is quite unique and very important.
So it's a good news story.
Yeah.
You know, we're 2 years into our journey with COVID, and we're improving treatments all the time. We now have oral antiviral tablets available. One is available on the PBS, one is available through New South Wales Health. And basically, this is one of the things that making sure that you connect to care if you've got symptoms of COVID-19 is so important. So the key thing is that these antivirals can help prevent serious illness if they're taken within 5 days of the development of symptoms of COVID-19, which is why it's so important to test as soon as you start getting those symptoms. There's information on the New South Wales government website about what to do if you test positive to COVID-19, and that includes a phone number to ring if you do test positive and you have got a significant medical condition. So people who are unvaccinated, people who are older, people who've got significant immune compromise, such as people who are currently receiving cancer treatment, people who are over 20 weeks pregnant, and some people of Pacifica and First Nations ancestry who are at higher risk of having severe COVID-19. They're all eligible for oral antiviral treatment. And either we will link you through to your GP who's willing to prescribe those medicines for you, or we'll link you through to a New South Wales health clinician who can help with that. So it's really important to do the test, register the results. And if you think you may have any trouble whatsoever with registering those rapid antigen tests, and you've got a PCR testing facility that's handy to you, go and get a PCR test. That will make sure that those results flow through into New South Wales Health, and we can follow up with you that way.
Thank you so much, Dr. Jan. It's really good to know about that antiviral medication. Minister Coure, I know Dr. Jan talked about this, about the isolation, but just wanted to give this question to you. There remains confusion over isolation periods for close contacts, particularly for large families where everyone may not test positive on the same day, or day one. Others may test positive later in the isolation period. How long do people need to remain in isolation? Does a time frame reset for every subsequent positive case, or can all the household contacts leave isolation on the same day if they have no symptoms? I'll put this to you because I'm sure you're getting a lot of these questions as well, but and pass it on to Dr. Jan. Minister Coure.
Well, yeah, certainly do. Getting a lot of questions in regards to this. Self-isolation means that you must stay at home or accommodation and must remain separate from others. You can only leave to get medical care, such as a COVID-19 test or in an emergency. You cannot have visitors at home. So you must self-isolate for the amount of time that you are told to, and your self-isolation period starts from the day you were tested or exposed to someone with COVID-19. For people who test positive to COVID-19 on a rapid antigen test or a PCR test, and their household contacts must self-isolate for 7 days as well. Now, if you have to self-isolate for 7 days, for example, you were tested at 10 a.m. on Tuesday, your self-isolation period ends 10 a.m. the following Tuesday. So Tuesday to Tuesday, 10 a.m. to 10 a.m. You must follow any health advice provided about when you can leave self-isolation. But please remember, if you have been exposed, you are at risk of developing COVID-19 in the 14 days after you were last in contact with someone with the virus. So most people who develop COVID-19 will get it in the first 7 days, and this is your highest risk period.
Mr. Coure, Dr. Jan.
So one of the things we're often asked in multi-generational households or households when there are a number of children is, when do people get to leave isolation? So the first thing is, we really strongly recommend that if at all possible, you isolate away from the sick person. So minimize the number of people who are having contact with the person who is unwell. It is not inevitable that after the exposure that you've already had, that keeping on being exposed can actually increase your risk of having COVID-19. So it may be that dad isolates with the kids while mum isolates away so that mum can go back to work. It may be about making sure that grandparents are isolated away from sick children. So particularly important that we do try and keep that isolation within our household. It is possible. I know lots of people, particularly who've got teenagers, older kids, other adults in the house, you know, splitting it into separate rooms as much as possible, really important. The rules now are that if you have isolated for 7 days as a household contact, you don't have to re-isolate even if you're re-exposed within a 21-day period. So say one child becomes unwell, you isolate with that child because that child needs your care. You leave together as long as you test negative to that COVID. You leave on day 7, even if, say, a second child becomes unwell that you've also been looking after. That child still has to complete its 7-day isolation period, so that's, say, Tuesday to Tuesday, but you could leave isolation. But please be really, really careful, because one of the things we do know is that, as Minister Coure said, we can have up to 14 days, and it has happened that somebody's had a number of children go down one after the other. It is actually in that 7 to 10 days after that last child that was, you know, became unwell that somebody's got COVID. So please be particularly careful, particularly if you're around older people or people who, you know, may have had a transplant who are more vulnerable to disease. Please be careful as you go about your life after that.
Thank you, Dr. Jan. And I guess the question about how important boosters are is still there, where even though people are getting sick and getting COVID, it is so important to still register and book your booster, isn't it, Minister Coure?
It certainly is. It's certainly very, very important to ask those necessary questions to your GP or medical practitioner. If, of course, you've had your vaccination and the allocated time for you to get that booster has arrived, to book that booster in as quickly as possible. I've got friends and family who are triple vaccinated, just like myself, but who have had a few, let's put it this way, near misses, But they put it down to the fact that they are doubly and triply vaccinated through the booster shot. So it's very, very important to get that booster shot because it is that added cocoon of protection.
Minister Coure, and the question for parents and about, are vaccines and boosters safe for children?
So at the moment, the vaccines are very safe for children. The Australian Technical Advisory Group on Immunisation is currently considering whether teenagers should also receive a booster dose. There is one group of children who should have 3 doses of vaccine, and they are the children who are immunosuppressed, so children who may be receiving treatment for juvenile arthritis or Crohn's disease, or who may have cancer, or may have been born with a natural immune deficiency. So for all of those children, their primary course is actually 3 doses of vaccine. So they certainly should receive 3 doses of vaccine. One of the things we do know about the boosters, though, is they really are keeping those levels of hospitalizations and ICU admissions down. We may still be seeing cases, but what we really want to do is keep our hospitals safe so that we can still have elective surgery, so that cancer patients can have their treatments without fear, so that our GP surgeries are still safe for us to attend. So those boosters certainly do reduce that demand on the healthcare system. And that means that for me personally, I'm less likely to be in hospital, less likely to have my family worried or concerned about me, and less likely to pass things on to other people. So those boosters remain incredibly important. I was hearing about the number of cases we've had in New South Wales, and whilst nearly 2,000 deaths is 2,000 that we never wanted to see, compared to the nearly 1 million cases that we've registered, and however many more that weren't tested through ever. That's incredibly small when we compare that to other countries in the world where they haven't had a good going vaccination program before COVID spread. So it's certainly helping, and it's certainly continuing to help. And the fact is that we are seeing fewer deaths, and that's directly related to the fact that people are taking up those boosters.
Thank you so much, Dr. Jan. And Minister Coure, you've mentioned having conversations with your kids, and also deciding for yourself as a parent about how safe the kids are at schools. For schools, how important it is for them to keep up to date with the rules and regulations and for keeping their kids safe at their schools.
It's absolutely vital that you follow the health advice. It's vital that you follow the advice from and the information from New South Wales Education. They have done an excellent job in ensuring that the children, families, parents receive those rapid antigen test kits. Getting tested regularly is important. Follow that health advice, and for even young kids, when your time has come to get that shot for those kids, because it's really important to, as I said before, to ensure that they get that protection in front of the rest of the kids in the classroom. Teachers are doing a great job out there ensuring kids are safe, and I think we've got to, in turn, as parents, ensure that our kids are safe as well by getting those additional protections.
Thank you, Minister Coure. And I guess it's 4:30, but Dr. Jan, one last question. With a new variant, how can we make sure that we're keeping ourselves safe?
Look, I think the thing is that we know how COVID spreads. We know how the new variant will spread. The new variant is more infectious than the previous variants, which means that it's just pays us to be really aware of what we're doing and how we're doing, but also to look after each other. And one of the best ways we can look after each other is if we have any symptoms, no matter how mild, doing a test. And again, if we know that, for example, I know people here at work say, there's cases at my kids' school. I'm getting those notifications from education, and they've got a big family gathering this weekend. Think about doing a rapid antigen test before you do go to those big family gatherings, particularly if there are older people or people who are receiving treatment for cancer, people who've had a transplant there. We can help keep each other safe. And I know in my family, we've avoided, potential exposure to older people by one of my family members. Child had a sore throat. They did the test not expecting it to be positive. Sure enough, it was. And again, by having done that test, they avoided, exposing elderly, frail people to COVID. And so those are the sorts of things that we can do. Again, if you don't have a rapid antigen test handy, a lot of our PCR testing clinics are available and do have capacity and will perform that test, or will give you a rapid antigen test to perform. So please do get tested. And if you do have a big family gathering coming up with all these amazing celebrations that are coming forward and that we're all looking forward to, one of the things we can do is help keep each other safe by getting tested.
Thank you so much for that, Dr. Jan. And Minister Coure, any final words for the media and those online?
Well, look, just very quickly, Multicultural New South Wales, working in with Department of Customer Service and Multicultural New South Wales Health, of course, getting material out, important government-related material, health-related advice and material as well to get translated. So that's going out regularly to community groups as well. We have provided over 150,000 rapid antigen test kits to some of our most vulnerable multicultural communities. There are more that we are delivering over the next few weeks as well. Ethnic Communities Council in New South Wales and other peak community organisations have also submitted expressions of interest, and I encourage them to apply. So if to the multicultural media, if you or your community know of community groups that are wanting to obtain some of the rapid antigen testing kits that Multicultural New South Wales through the Department of Communities and Justice have obtained, then certainly communicate with Multicultural New South Wales through their website, send them an email, and they'll be able to put you on the list and work out to see if there are kits there available for you and your community. But there is a lot happening in this space, and I just want to thank again the wonderful work of multicultural media.
Thank you so much, Minister Coure. And Dr. Jan, any last words?
Just to thank everyone very much and hope that we get prepared for some lovely times ahead. But please do be careful at the moment and do think about testing with even the mildest symptoms, and please keep encouraging people to go and get those vaccines.
Thank you so much, Dr. Jan. And on behalf of the Ministry of Health, Multicultural New South Wales and the New South Wales Multicultural Health Communication Service, we thank you for always joining us and joining Minister Coure and Dr. Jan for these sessions. And we hope that if you have any questions, send them through and we can have them answered on these forums. And we'll keep going and making sure that we also share the resources on our social media platforms. So please share the post on your channels. In the meantime, our thoughts are with those people who have been affected with the flooding and the war in Ukraine. And we hope that you are all safe. Take care, and we'll see you again next week.